Perhaps I speak for everyone in this room in saying that in an ideal scenario, having a child should be a matter of personal choice, not dictated by financial, legal, or medical constraints in particular. And it's in scenarios such as these that assisted reproductive technology, namely in vitro fertilization or IVF, has come to the rescue of millions of childless couples, enabling them to experience parenthood. And in light of World IVF Day, celebrated globally on July 25th, to shed more light on this subject and more specifically, the scientific, emotional, and psychological aspects of the journey, I'm joined by a highly distinguished panel of domain experts. With that, I welcome you to our special televised feature, For Her, With Her. An initiative by Alembic CSR presents Let's Talk Infertility and IVF, in association with the Federation of Obstetric and Gynecological Societies of India, or FOGSI, and the Indian Society for Assisted Reproduction, ISAR. Please allow me to introduce our guests. We have with us Dr. Jaydeep Tank, President, Federation of Obstetric and Gynecological Societies of India; Dr. Amit Patki, President, Indian Society for Assisted Reproduction; Dr. Sunita Tandulwadkar, President-elect, FOGSI and ISAR; Dr. Kunal Doshi, Joint Secretary, FOGSI; and Dr. Sunita Chandra, Director, Morpheus Lucknow Fertility Center and Rajendra Nagar Hospital and IVF Center, Lucknow. Well, doctors, thank you so much for taking the time to join us in studio. And for sake of some context setting, Dr. Tank, if I could kick off the conversation with you. For the benefit of our viewers, I'd like for you to break down IVF or in vitro fertilization in layman language.
At its very basic, pregnancy involves the sperm, which is the male egg or the male gamete. It involves the egg or what is called an oocyte, and then it involves the uterine cavity, which is typically called the womb or garbhashay. If you really think about IVF, it's essentially of putting the sperm and the egg together and then implanting them into the uterus. The IVF process is therefore broken down into two essential steps. There is the step of collecting the sperm and the egg, which is the male and the female gametes, and then putting them together in a process called fertilization. And then once you have a ready pregnancy, what is called an embryo, we put that embryo back into the uterus. Collecting the sperm is typically easy. It involves the male ejaculating, or if sometimes there are no sperms in the ejaculate, we now have the capability of actually retrieving sperm from the testes. For the oocytes, we give injections which are called gonadotropins. They typically go on for 10 to 14 days with some monitoring in between to see how the eggs are growing. And once we feel that the eggs are ready, we ask the patient to come to the IVF theatre where she is given anesthesia, and then via a transvaginal ultrasound or a sonography done from below. Again, there's no cutting, stitching or dressing in this kind of a procedure. It's just an ultrasound. And then we retrieve the eggs under vision. These eggs are then sent to the laboratory where the biologist puts the sperm and the egg together. And this could happen one of two ways. It could happen by what is known as in vitro fertilization, where the sperms simply are put around the oocytes and then they find their own way into the egg, or by a procedure called an intracytoplasmic sperm injection called ICSI, where one sperm is directly injected into an egg. Once this is done, the gametes, which are now known as embryo, which is a pregnancy, are then kept in an incubator for 2, 3 or 5 days, depending on the patient profile, the number of eggs and so on. And then we do an embryo transfer, which is literally what it means. We transfer the embryo back into the uterus. Once we do this, then it is up to the embryo and the uterus to have a dialogue. And if that dialogue is successful, then a reaction called implantation takes place and there is a pregnancy.
And sir, to the second part of my question, in terms of debunking some of the leading myths that surround the process.
Well, there are so many myths, but the leading myths, I would say, are that IVF is incredibly painful. I would have to say that with the current way we do IVF, IVF is actually physically a very non-demanding kind of a procedure. The second myth is that babies born from IVF are in some way different from babies born naturally. That is also completely untrue. Another popular myth is that if you do an IVF, you will always have twins.
Right.
And that is simply not true anymore.
Multiple births.
Or multiple births. We don't really transfer those many number of embryos anymore. There is also this myth that if you conceive from IVF, during your pregnancy you need to take full bed rest. Once you are pregnant, whether it's from IVF or from any other way of conceiving, naturally, IUI, so on and so forth, that pregnancy is a pregnancy like any other pregnancy.
Sure.
And the way you behave in that pregnancy will be absolutely the same as any other pregnant woman would behave.
Coming to you now, Dr. Tandulkarkar. What age or stage in an individual or a couple's journey towards trying to conceive might they consider IVF? What are some of the risk factors associated with the process, ma'am?
You know what? It differs from couple to couple. There are certain causes beyond explanation. You know, sometimes the egg covering may be very thick and the sperm may not be able to fertilize. Then you keep on doing only the checking of ovulation and ensuring that the relation or your IUI, where we take the semen sample, we process, and good quality sperms are put in. We just expect that to work time and again. That's not right. Because any of these procedures will have a maximum success in first 3 to 6 cycles. Sure. You can't keep on trying that way about 2 years, 3 years. Yeah. So sometimes you have to come to the term and proceed for a IVF to cut short probably time to pregnancy. But some unfortunate couple where the tubes are blocked. In India, tuberculosis was most common condition. Yeah. Or they had previous pregnancies in the tubes and that's why tubes were removed. Or the husband don't have enough sperms. Uterus is damaged or the surrounding of the uterus, there is extensive endometriosis where the natural process of fertilization, that is the relation of a fallopian tube with the ovary, is completely distorted and the tubes are not going to pick up the eggs from the ovary. So there is no point in waiting. Earlier you take the chance with the IVF, better your success rate, because everyone has to understand that success also depends upon the age. Complications related to injection procedure are very, very minimum. But I will say emotional and psychological stress is the most important complication or the factor which we as an ART consultant need to deal with.
Coming to you now, Dr. Patki, because egg freezing is on the rise. It's becoming increasingly popular, right? What are the key considerations with respect to this process? Not just around a woman's age, but this whole overarching concept of fertility preservation in general, sir.
Egg freezing is something which is most trending now in infertility. But understand that egg freezing was actually meant for a medical cause. So young girls who were undergoing extensive surgery, who would perhaps need chemo or radiotherapy, we would advise them to have their eggs freezed so that they could use them later. Now it is being moved on to social reasons. So there are women who still haven't found their right Mr. X and who are concerned that by the time they get to going having babies, their age may be slightly increased, and that is why they do egg freezing. It's a very good concept. Unfortunately, the group that comes for egg freezing is the group which has already missed the bus. As doctors, we have to counsel them because they have to understand that this is no 100% surety that they will get pregnant from the eggs that they freeze. And there is a benchmark that you need minimum 15 eggs to freeze for a IVF specialist to tell you that I can get you one baby from this. The other thing is that we as fertility specialists encourage people to get pregnant early because the woman's age is the most important determinant for success. So although egg freezing is something nice, something which needs to be percolated down, but I also tell them that don't push being a mother too late.
And coming to you now, Dr. Chandra, what's your comment on the environmental impact of IVF, given the water usage, given the energy consumption, and given the fact that multiple embryos are disposed of?
So, you've rightly asked, the question is very, very important. Actually, we are ignoring this, and this is the time that we should not ignore this environmental problem of any health sector, whether it is IVF or another health sector. To your knowledge, health sector is the most important sector where we are producing most of the greenhouse gas, GHG and the carbon point. We are not actually advocating save the water. So, these are two important things, save water and save energy. We can have our own energy plants like solar plantation, hydroelectric plantation. We can actually advocate, make awareness programs to save the water. As far as surplus embryos is concerned, we have to discard them or use them for research purposes with very strict ethical guidelines and with the consent of the couple. In our IVF, we are using everything one-time use, plastic disposables. We can have lesser of that. Second thing, everything instead of getting on paper, it can be just digital. So, we can use less paper. Then instead of using plastic bags, we can use reusable cloth bags. And the important part is that we have to make awareness program right from the doctor to nurses to the counselors to the support group to the patients to our embryologists to the office, that you have to cut on using water, you have to save energy, because that is how we can save our planet. And so, we should take plans to have green IVF.
I agree. Let's take a look at the past for a moment. And I want to come to you now, Dr. Doshi, because IVF in and of itself is a 40 to 45-year-old technology. It is fairly new. It is fairly recent. So, a two-part question here. What do you consider to be some of the most significant breakthroughs that have truly transformed patient outcomes and success rates? And secondly, what's the most promising area of research or innovation in this field going forward?
The research in the last decade or half has mainly aimed towards the patient safety, the couple safety and the women's safety. And as the point was already discussed, that ovarian hyperstimulation now is a thing of a past. In probably last 10 years, I have not seen a single patient having ovarian hyperstimulation. It's completely avoidable. That for me is a single game changer, which has been the progress till now. The future is of course very, very interesting. In introduction of AI in IVF can help at a various stages in the couple's journey. Right from the patients when they are in the clinic, you are taking down the history when you enter the data, and AI will have a predictive algorithm, right? It can help in probably having a kind of a success rate prior to the couple actually undergoing the cycle itself. Also in the lab part, when AI is introduced, right now where we stand in IVF is probably maximum say 40 to 50% success rate. And that's primarily because you cannot know which embryo is actually the one which is going to implant. When you have an AI model in place in lab, AI can help in identifying that a good embryo which has the maximum chance of a potential. Now that will in turn lead to the number of cycles that a patient has to undergo can reduce. Right. It can also help in reducing of course the cost, correct?
Right.
And there are like amazing innovations which are already there. There are oral drugs which are there instead of injections. Now just imagine a couple undergoing an IVF does not have to take a single injection.
Right.
That is something what we are looking forward to.
Yeah. It's time for a short break, but don't go anywhere. We'll be right back. You've all offered us a sneak preview of what the future holds, but let's get back to the present. And given that it's an election year, what more would you like to see from policymakers or the broader healthcare ecosystem by way of support for IVF patients? Because it's incredibly emotional, complex with its financial aspects, psychological aspects, and the physical journey, of course. So, whose doors can they knock on for support?
What we really need to work on are more patient-friendly protocols, tinging reassurances, because IVF patients are typically vulnerable. They are constantly seeking reassurance that we will be all right, we'll get a pregnancy. And we would like to keep on reassuring them, but we should remember to tinge this reassurance with a hint of reality also.
Sure.
It's a difficult line to walk. And also lastly, the financial aspect. Well, at the end of the day, Pooja, the fact is that someone has to pay for medicine. All right, we like to think that in a utopian world, we'll have universal health care and everyone will get health care which is accessible, affordable and so on and so forth. But someone has to foot the bill. Right? And one of the ways that we can foot the bill is either by insurance. Unfortunately, insurance is not really very easily available in the fertility sector. We really need to rethink about this. And the second is public-private partnerships. Public-private partnerships, I think, are going to be key, particularly in making these more advanced treatments available. Let's also keep in mind that while we are talking of IVF, everybody who's infertile doesn't need IVF. In fact, a very small number of people who are infertile will actually land up needing IVF, but for that subset of population, a public-private partnership would certainly be useful, where, for example, the state could play the role of the payer and the private sector could play the role of the provider. We need to achieve a win-win situation where both partners feel that they are benefiting, and the ultimate beneficiary, of course, is the couple who seeks treatment.
No, thank you for sharing
Pooja,
that, Dr. Tandulkar.
despite
Yes, Dr.
WHO classifying infertility as a disease,
Right.
and rightfully it should come under insurance, it doesn't happen. So this is something that we as fertility people know that we have to work to the government, speak to the government, because in not every insurance will pay you for infertility treatment. There are some private companies who offer some treatment, there are some private companies who will offer for egg freezing or medicine, and that is something which it happens, it will open up many more doors and many more opportunities, and with partnership treatments, I think it will be something that will reach a near universal acceptance.
Well, Dr. Patki, that makes for a wonderful segue into my next question, which is to you, Dr. Tandulkar. If you find yourself in the situation where a patient is unable to conceive naturally, and yet she's also unable to afford IVF,
That's a very painful situation, Pooja.
how do you navigate this scenario?
We all, as we age, we need to start thinking about giving back to the society, right? Khali haath aaye hain, khali haath jayenge. So 1 year before the COVID, I started sponsor a birth concept.
Okay.
Sponsor a birth means, suppose I have a builder or I have an industrialist or a little well-do IT couple and they got a baby, they can sponsor the other couple.
Sure.
Amit was a part of that process where I identified in 27 states, 27 friends of mine who are ready to do the IVF at no profit, no loss.
Phenomenal.
Unfortunately, COVID came in, that project got completely collapsed, but at individual level, my sponsor a birth project is going on, and I'm so happy on this platform I got. There may be many more people who can join hands.
Doctor, we salute your efforts, we celebrate them. Please.
Sponsor a birth is a very good initiative, and we have been part. But ISAR, which is our organization, has an endowment fund, which is a 1 crore donation done by one of our own fertility doctor, and we sponsor 50 IVF in a year. So we partly sponsor the payment.
Now, genetic testing is becoming increasingly popular, but help us better understand some of the ethical considerations in play here, especially when it comes to selecting embryos with specific genetic traits. And likewise, what are the risks? How do you navigate them?
Just because a technology is available, it doesn't mean it has to be used for every patient. Okay? So genetic testing is to be done for couples who have had a previous child with some genetic disorders, or they have some genetic traits which can be passed down, like thalassemia or Duchenne's muscular dystrophies.
Sure.
Or the woman's age is over a particular age, and most often over the age of 42. In these patients, because they are the high risk patients in whom these genetic problems are more. Now, understand that when I am doing a genetic testing, the couple asks me, so is this embryo completely normal? I shudder to think that, because what I've tested are the major chromosomes. There are 30,000 to 40,000 genes, and all of them can give some problem. So it's humanly impossible for me to test all that. And that is something which is very important, that you counsel the couple in whom you actually think it needs to be done, and what are your limitations of genetic testing.
Well, Dr. Doshi, coming to you now. When we talk about patient support groups, who are a critical part of the IVF puzzle really, what more would you like to see from them, by way of not only raising awareness around the realities of infertility, but also advocating for the improved accessibility to IVF in the first place?
So it can work at a multiple level. Patient support group can be in either form, even probably a Facebook community itself can work as a patient community. A penetration to the tier 2, tier 3 areas is very important now, as it was already mentioned that the IVF cycle is very standardized now, and access to the treatment is only possible once you demystify the myths around it.
Right.
It's absolutely, once that is out, a lot of patients will have an acceptance to it, and support group can help in creating that awareness. There can be a lot of BTL activities which can be done where people understand in tier 2, tier 3. Also, insurance, which was a big part of the discussion about the affordability, can play a big role. And infertility is a disease which is not seen as a disease. It's affecting the couple at so many levels, and if that couple can actually have a child, the life changes for them completely.
Sure.
So creating awareness, dispensing all the myths around it would really help in the couple going for an IVF cycle.
Well, Dr. Chandra, the panel has highlighted it beautifully in terms of what we can expect from policymakers, the broader healthcare ecosystem, right, patient support groups. But what about the general public?
Yes.
Because the social stigma that surrounds IVF is very
yes.
deep-seated,
Yes,
and that's going to require a mindset shift.
So I
that
think
spans
media is
generations.
the best. Media is the biggest influencer. I mean, awareness programs on the media, awareness programs at every level, right from the society, right from your clinic, your, as he said, support group, your staff. Everybody can do the awareness programs in their own way.
Well, I trust our viewers are hearing you loud and clear. Well, thank you for sharing that, Doctor. And I want to close out the panel with a final question to all 5 of my panelists. And Dr. Patki, I'll start with you. Now, in your capacity as medical professionals, what's the single most critical thing you can do to ensure that these advancements in reproductive medicine, as we've been discussing, are accessible and ethically sound?
Increase awareness, give them realistic expectations of the treatment, counsel your patient very well before you take them up for treatment, and encourage people to be young couples when they have the baby.
Phenomenal.
I think he answered for all of us. But I will also say, do ethical, evidence-based practice in infertility, and if you know that this couple is not going to conceive even with IVF, have the courage to explain this to the patient instead of wasting their time, money, emotion,
hopes, expectations.
Everything.
Dr. Chandra, over to you. Same question.
Support them emotionally. That is very, very important.
Dr. Doshi.
Going for a treatment to a right place, rather than we have seen couples, going for years and years, undergoing some treatment which is not evidence-based. So they have to understand fertility will need a specialist to identify the cause and undergo a right treatment to reduce the time to achieve a pregnancy.
Absolutely. And Dr. Tank, I'll give you the last word. The floor is yours.
Yeah, so I'll echo what everyone said, but I will also add this one thing, and that is the way popular culture perceives infertility and pregnancy, right? And I think this is a problem because popular culture is obviously very influential. Infertility being projected outside the lens of reproductive choice,
Sure.
for me is very, very problematic. You look at any TV serial, you look at a movie, you look at stories written, your blogs written, they all project infertility as a disability. Right. when we should actually be looking at it through the lens of reproductive choice and say that yes, I am unable to conceive. The couple should be happy enough or free enough to say that, and I think this can be enabled through popular culture.
Well, I believe that makes for a wonderful note upon which to close. What a pleasure to have you with me, and I wish you all the continued success. And with that, our special feature, For Her With Her, an initiative by Alembic CSR, presents Let's Talk Infertility and IVF, in association with the Federation of Obstetric and Gynecological Societies of India, FOGSI, and the Indian Society for Assisted Reproduction, ISAR, comes to a close. I'm Pooja Jain signing off. Thanks for watching.